Hello, welcome to Fibro Warrior, my new normal. I'm MJ Aragon, and I'm here with my producers, JoJo Merrickx
Hey.
and Tony Jeffries.
Hi.
Today is going to be a pretty easy day. I'm going to share an article on RA and fibromyalgia. I've talked about it a little bit before. I recently discovered this year that I have RA, rheumatoid arthritis, and we were fairly certain that I had had it 4 years ago, but the times that I was tested, I came out seronegative. Now, if you come out seronegative, that doesn't necessarily mean that you don't have it. It's just not active at the time. So now this past February, actually I think I took the test in January and I got the results in the very first week of February, I believe. And so now I'm positive, and I've covered all the markers. I think there's 3 different ways that they test for it. So I definitely have it, and I went to see my rheumatoid doctor yesterday. And my concern is when I was a child, I contracted TB, tuberculosis, and in a very unfortunate way, because it's a touchy subject, I was molested as a child, and the person who molested me had TB and gave it to me. So the last time we saw him, he had tried again, but I was 8 at this time. We moved to California right after, and I had tuberculosis, and no one else in the family had it, and we couldn't figure it out. We had called all our family members. We had every single person got tested, and no one had it, and we couldn't figure out what it was. And of course, later on, putting 2 and 2 together, he's the only person that could have possibly given it to me. So I have lovely gifts from this man. Anyway, so because I have TB, it's not active. I can't cough on somebody and give it to them. It's dormant. I'm not contagious by any means. But once I start taking the medications that are prescribed for rheumatoid arthritis, it's likely, more than likely, that it will activate the tuberculosis. So in that case, and tuberculosis is deadly, mind you. So in that case, I will be given medication to not only fight the RA from disfiguring me, I'm going to have to fight tuberculosis so that I don't die. I'm saying this lightly because I'm trying to keep a positive attitude. This is not something I'm looking forward to doing. So I let my doctor know, I don't really want to take the medication. There's a whole bunch of reasons, and a big, a very important reason is this. I love doing this. I love talking to you guys every week and writing my blogs, and this is important to me, that I'm helping you guys and you guys are helping me. This is important, and my concern is that if I start taking those medications, I hate when I do this, my immune system will be severely compromised. So anyone being sick, cold, anything, like I will get very sick from it. So I will have to avoid people. I probably will feel too sick to do this, and I don't want that to happen. So I'm going to put off taking those medications for as long as I possibly can. I don't know how long. We haven't discussed this in length by any means yet, because this is a new rheumatoid doctor I'm seeing. I couldn't go see my old guy, unfortunately. But she's wonderful. I like her a lot, but we haven't discussed the effects of that and how long it would last and how long I have to take the medication. So we'll get to that probably in our next visit. We had a lot of things to catch up on. She had a lot of questions, and the worst part was that I get there and I have to fill out this paperwork, and they ask a myriad of questions, as you all know if any one of you have had to go do this in any doctor's office. Basically, you're a new patient, you fill out so much paperwork and so many questions, and that in and of itself is very stressful. So I had crazy anxiety. A big part of that anxiety is me being concerned that I'm going to forget something. And when you're trying to fill out your paperwork properly, forgetting something's a big deal. So, because something you forget to mention may be important. So when you're filling out the paperwork, I'm like, do I have this? Silly things like, do I have dry mouth? I remember questioning, like, I don't think I have dry mouth. I don't remember if I marked it down or not, but I think we talked about it later. But then later on, I'm like, yeah, I have it on here all the time. That's why I'm sometimes my mouth is dry. I'm like, I get it all the time. And even that day later on, my mouth was dry. And I'm like, how do I forget that? It's something simple. It happens all the time. But at the time, I was like, do I? I had to think about it. And I couldn't remember at that very moment that something that simple. So yeah, it stresses me the hell out when I'm filling out this paperwork and I'm thinking, have I forgotten something that's important? And if I have, is that going to be a big deal? Is it going to change things? Is she going to give me the wrong, you know what I mean? It's concerning. So I spent an hour filling out this paperwork, sitting in this chair. And I don't know if I mentioned before that I was weaning off of my Savella, so I was off of it for like a week. And I just started getting back on, so I'm only taking 25 milligrams a day.
What's that for again?
It's for the fibromyalgia.
Okay.
And it's not really covering the pain. And so sitting in that chair for an hour, and the anxiety on top of it and everything, I was stressed out. It turns out my blood pressure was through the roof. And I'm like, well, it's probably anxiety. And then as I'm sitting there longer, I was in this office for 3 hours.
This is yesterday.
This was yesterday.
That's why you didn't get sleep.
Yes. And I had a dentist appointment today. So, and I'm such a night person, I'm so nocturnal that when I go to sleep, it's like, you know, it was I only had 2 hours before I had to get up. I went to sleep at like 7:30, I think. I had to get up at 9:30. And then what I do, so my phone is a piece of crap right now. So my phone keeps dying on me, and I charge it, and sometimes it charges a little bit, sometimes it doesn't charge at all. I usually have to turn it off in order to get it charged. So I don't know about everybody else, but all my alarms are my phone. So I had set my alarms earlier, 2 of them, to make sure that I get up. And then later on, I'm like, I should turn off my phone so it'll charge, forgetting that I need my alarms. So I wake up at like 10:20, which we weren't late or anything, but I planned on getting up earlier so we could do some things before the appointment. So I wake up and Bill's like, didn't you switch? I'm like, yeah, I set my alarms. I'm looking at the clock. I'm like, no, I checked it. I made sure I saved it. I made sure it said I had X amount of hours to sleep, and I made sure it's the right day. What the? Oh, I turned my phone off. Lovely. I'm glad I wasn't late for the appointment. That would have sucked because of my very first one. So anyway, I was already tired on top of that with 2 hours sleep. Sitting there filling out paperwork, which stressed me out. And then I get into the office, and they had thought that I put 79 instead of 69, which was very flattering that they thought I was 10 years younger. Thank you. So they were looking for my blood work, and I couldn't find it. I'm like, I'm pretty sure it's LabCorp. Are you sure it's not Quest? I'm like, it could be, but I'm pretty sure it's LabCorp. He checks both of them. Nobody can find anything, of course, because they have the wrong year. So I'm like calling Bill. I'm like, baby, can you get my paperwork and make sure it was LabCorp, and can you take pictures of it? So thankfully, he took pictures of it because I showed it to the RN, and he was like, oh, 69, I'm not 79. I'm like, no wonder. Right. So I sat there for an extra hour because the blood work is coming. So she went on to the next patient.
So they had to finish with the patient.
Yes.
Right.
So I was in the office in those chairs. All the chairs were the same for 3 hours, and I was like this, adjusting, rubbing my back, like moving around, standing up, sitting down, like, and the pain was just getting worse and worse. And then I realized, because she kept checking my blood pressure, but it was going up instead of going down, where normally I have like this a mild, it's a little high, like mildly though. And that's usually because maybe the white coat syndrome, because normally my blood, so my blood pressure goes up a little bit, not a big deal. And they're like, have you ever had, I'm like, no, I don't have blood pressure issues, But when they checked it again, it was even worse. And so I was like, well, I was really stressed out with paperwork, which that would raise it. The anxiety being the doctor, first time thinking about the tuberculosis, RA, like I had a lot of things going on in my head and no sleep. And then I realized the pain was getting worse. The more the pain that I was in, the more my blood pressure went up. And I'm like, oh, that makes sense. Because I know when I have migraines, my blood pressure goes up.
Huh?
Yeah, so I was like, aha, that's it. So anyway, she's really funny. She kind of reminds me, she's sweet and nice, and she kind of has that, like, her little girl is still in her. Like, she's a smart, brilliant doctor, but she still has that fun, sweet, like, she enjoys her job. And
right.
I think that's pretty cool because you don't come across that too often. I mean, I have great doctors, thankfully. My primary care doctor, he sits down one-on-one and gives us eye contact. He sits down so that his eye and our eyes are aligned, not standing over us, not sitting over there, not facing away. He sits and looks at us and talks to us, And not all of our doctors do that. And they're so focused on the paperwork and stuff, they don't really look at you and give you eye contact. So I'm really happy with my primary. And then to have her so lighthearted, and it was kind of awesome, but strange,
Right.
because it's not something that you normally come in contact with, a doctor that's like la la la, you know. So it was kind of refreshing, but I wasn't able to appreciate it wholeheartedly because I was in pain. So. But yeah, so we talked about a few things. I have to have some more blood work done. There was a few things that she saw that she wanted to do it to check again. And my cholesterol was a little high, and I think that the reason for that was because we were still catching up and things, and I wasn't eating as healthy as I should be because, we were trying to get by. So we were eating foods, I was eating things I shouldn't be eating, that I would normally eat anyway, but being that, you have a certain income, a certain amount of money that you can spend on groceries and everything else, we were buying pasta and all this crap that I shouldn't be eating, a lot of processed stuff, which I usually avoid. And so I was like, I guarantee it was because of that. And I think that they had told me I didn't need to fast, which also may have had something to do with this. So this time she's like,
you didn't
I
need
did
to
not,
fast?
yeah, they told me I didn't need to fast.
Before the hospital, the visit.
And I'd
Okay,
eaten something right before, and so I'm thinking to myself, that may have had something to do with it. So this time she's like, for sure fast, nothing for 8 hours.
For the next one.
Which will probably be more like 12 hours for me if I go to sleep and go to the appointment because it's a later appointment. Then I won't eat for hours and hours because I'm not hungry right before I go to sleep anyway.
Do you still drink water during those
yes,
times?
we can still have water, yeah. Because
But do you personally drink a lot of water during those
I
times?
do. I have
when you
water. I have water next to my bed all the time.
Okay.
I always have water.
Have you tried the alkaline water yet?
I have. Actually, alkaline water actually worked wonders with heartburn. If you have heartburn or acid reflux or even silent reflux, if you don't feel it, the doctors can test and find out you do. If you have that, instead of taking the medication, because I did take the medication and it affected my eyesight. Omeprazole, I believe, was the medication. My eyesight started waning a little bit, and I was like, I'm taking enough stuff. Like I got off of it, and I was drinking the alkaline water, and that helped just fine.
Right.
I also started avoiding coffee. I noticed that coffee was causing that as well, and tea doesn't seem to do that.
Any better? Or
And
not as bad?
no, it doesn't seem. And then I have a non-dairy creamer, which kind of helps a little bit as well. But with the coffee, it didn't matter. Even the creamer and the coffee was still just a little too acidic for me. So the alkaline water really, really can help with that. I'm not saying it's a cure-all, and I know there's supposedly these diets or whatever, alkaline water is supposed to do all these wonderful things. I can't attest to that, but I do know that it helped me significantly with my my acid reflux, or silent reflux is what I had. It all healed. My voice was really, really scratchy and sounded like it went down a couple octaves because my throat was so damaged from it, from the stomach acids and whatnot. So I could tell that it was healing and things were getting better, even though I wasn't feeling it. On occasion, I do get the acid reflux, but it's very rare. But anyway, so sitting there for 3 hours, I was dying. So then I got nauseous because the pain had gotten so bad. And I'm like, she's still waiting for her. So I'm asking the RN, I'm like, do you guys have any nausea medication? He's like, there's a leave. I'm like, no, I don't want pain medication. I'm feeling nauseous, And you can find anything. I'm like, fine. I'm going to take ibuprofen. Now.
That helps?
Ibuprofen helps because it's inflammatory. It's
anti-inflammatory?
Anti-inflammatory.
Right.
So I'm not supposed to take it, though, because I'm already taking meloxicam, and taking that on top of it's really, really hard.
That probably raises your blood pressure.
It's really hard.
Too.
Yeah. Well, no, I took it after. This is later on.
Okay.
My blood pressure probably went down because the pain.
Because of the
pain went down.
Went away because
Well, it didn't go away, but it definitely decreased it.
So subsided slightly. Huh?
Yes, and I have to take 4 of them. Anything less than 4, ibuprofen or Advil.
Doesn't really do
pretty much.
anything. Huh?
It doesn't really do anything, so I have to take 4. So because I have to take so many in order to help me, I have to be very careful. So because I took that yesterday, I won't take one again.
For about
unless I'm dying, I won't take
like a migraine or something crazy.
I'll avoid it because just get point blank, my urine actually gets darker. Like I can tell that my kidneys or whatnot are having to work harder because of it.
Right.
Yeah. And the doctor even said, like, you shouldn't take ibuprofen. I'm like, I don't do it all the time. I'm very aware. I'm very conscientious, but every once in a while, I need that extra help. And it doesn't take it all the way, but it definitely takes the edge off, which was what I needed. And it did help, and it worked quite quickly. I was actually surprised at how fast it worked. I was very thankful, actually, because within like 20 minutes, that pain was starting to subside, and I was like, oh, thank you. But so anyway, so I have to go in for a blood test. I'm going to fast for 8 hours. I'm going to eat properly this weekend. She told me to do it today, but I knew I had stuff to do, and I have to take food with my medication. So I figured Monday I can do it. I can get it out of the way in the morning and then take my medication later, and then not have to worry about having to fast when I'm taking medication. And then I don't know if taking medication is an issue. I think sometimes they say you can, but I just didn't want anything to interfere. So I figure if I get decent enough sleep and I go take care of that, and I don't eat anything for 8-12 hours, you know, it should be a more accurate blood test. And I also have to do a bone density test, which I've never done before.
How does that work?
I have no idea, but I shall tell you guys as soon as I find out.
Bone
I
density.
have had the nerve testing, and where they take these needles and they poke them in your arms in certain various areas of your muscles and whatnot, and they'll do it in your legs, and they'll have a test leg that doesn't have the pain opposed to the other one. And so I've had my arms, my legs, I've had this done a bunch of times, and I know that when I first was having it done, late 20s, early 30s, I think it was the first time I actually had the nerve testing done, and they couldn't find anything, and I was in so much pain, and I'm like, you got to find something. And this is before I knew I had fibromyalgia. So now, of course, I know what it is. But these days, my arthritis and everything has wreaked such havoc on me that it is causing nerve damage. And I have pinched nerves in my neck, which makes my hands and my fingers go numb. I have damage in my elbow as well. And I remember my doctor told me, oh, sleep with your arms straight. I'm like, that's not going to happen. When I'm asleep, I'm like,
Right, like how are you gonna?
I go to sleep and I try to keep it that way,
Yeah,
but
but something
eventually,
happens.
yeah. So I'm like, I'll try, but
Do any of the ointments work with arthritis?
they
Like,
do. Yeah, there's one that I have. I can't remember what the percentage is, the milligram. Voltaren, I think it's called. I do use that on occasion. Once again, I do not like taking medications or use anything,
Use it
so
when-
I only use it when I'm dying, when I need some help, or if I already taken Advil and I want to take Advil again, then I'll use that.
Even ointments?
I just don't.
Is there a negative response in any way, like skin response or anything with?
Well, I haven't discovered. I mean, it makes you feel dry. It's
Really?
drying because it's like a alcohol in it or something. I
Whatever-
guess to help
whatever
it,
takes the
whatever
pain
makes
away.
It, well, whatever makes it absorb as well,
Right.
because it's like a gel type thing.
Right.
So it makes me, and it smells. The smell's not that wonderful either.
Like Bengay,
No,
not like that.
not Bengay. It's not that smell. That's a very recognizable smell. But it's a medicine-y smell. It's like alcohol-y. I can't really. I haven't smelled it in like over a week, so I can't recall exactly. But it's definitely a medicine smell. But it's not overpowering like Bengay can be, where you can smell it across the room.
Everywhere.
Yeah,
the freaking
and
house.
it does dissipate after a while. It doesn't last forever, so that's another good thing. I'm just stubborn. I'm just stubborn. I don't like taking medication. I don't like, and I let myself suffer for a little while
Well,
before.
I can understand the
before,
medication, but
yeah.
the ointments. That's why
I can't remember because I think it's something. It's like putting a medication in your body, but you're doing it topically. So I imagine it affects us in some way.
In some way, huh?
But it's
Yeah.
not going through our. It's not going through our kidneys. It's not going through your organs in any way. It's not going through your system. Was what I meant to say.
Right.
So I don't know if it's directly affecting anything like that, but it's still medication. It's still something to help with the pain. So I imagine it has some effect.
Right.
So I don't know what exactly. But so 3 hours in the doctor's office, and I let her know my concerns about taking the RA medication and the tuberculosis and all that stuff. And so she said, okay, let's do these blood tests, see how everything's going, and then and I'll see her in 2 weeks. So in 2 weeks I'll get back to you guys and let you know what's going on and how the blood tests turn out and what a bone density test is exactly. I know my mom had one, but I can't remember. I don't remember if she described it to me or not. But yeah, it didn't seem like it to be a big deal, and hopefully I'll be like her, and because she kept her bone density is still fairly good. My mom and I are 17 years apart, so she's 65, and she's still going strong. She's stubborn like me, about getting things done. Like they're moving right now. They've been in this house for 23 years, and now they're moving, and there's boxes everywhere. I went and tried to help out, and but it's stressful. You'll be in one place for so long, you accumulate all these things. And I wrote a little post on Facebook about that because our relationship wasn't the tightest, and and ups and downs through the years. But with the way I've grown and they're getting older and things change, and you just get to a point in life and like, I need to heal. I need to get past this. They are who they are. I'm who I am. They've changed in their way. I've changed in mine. And I actually enjoy myself sitting down, talking to my parents, where there was a time where I didn't feel comfortable. I didn't feel at home. I just went to visit because I knew I should. And now I go there and joke around and laugh and have fun, and I say I love him, and I feel like I love him. I'm not saying I love him because that's something that you do. That's
something you say, right?
Yeah.
Yeah,
I love you. I give him a hug. I'm like, it's different. It's a different feeling, and I'm really
authentic experience
yes,
now, huh?
yes.
Let those things
and
go
and I'm
aside.
really relieved. So I can only hope that I have that same experience with my kids. My kids and I are not super tight right now. Things that have happened with my ex and his wife, and the way that I've been talked about throughout their life, I get where they're coming from, so I can't be mad at them. So I have to look at it this way, that hopefully, they will grow and change,
I'm sure they will.
And we'll all come together as well, because it can happen. Because my relationship with my parents was not great. It really wasn't, and we've come such a long way. So I have high expectations that someday we will, and I have to look forward to that. So I'm going to read this article. It wasn't too long. I looked for a few with the crossover of Fibro and RA, and this one seemed to be a decent one. It is on the Arthritis Foundation page, and rheumatoid arthritis causes, and it talks about both rheumatoid and fibro. Let me get some water, excuse me. Okay. The cause of RA is not fully understood, although doctors do know what an abnormal response of the immune system plays a leading role in the inflammation and joint damage that occurs. No one knows for sure why the immune system goes awry, but there's scientific evidence that genes, hormones, and environmental factors are involved. Researchers have shown that people with a specific genetic marker called the HLA shared epitope have a 5-fold greater chance of developing rheumatoid arthritis than the people without the marker. So the HLA genetic site controls immune responses. Other genes connected to RA include STAT4, a gene that plays important roles in the regulation and activation of the immune system, TRAF1 and C5, 2 genes relevant to chronic inflammation, and PTPN22, a gene associated with both the development and progression of rheumatoid arthritis. Yet not all people with these genes develop RA, and not all people with the condition have these genes. Researchers continue to investigate other factors that may play a role. These factors include infections agents such as bacteria or viruses, which may trigger development of the disease in a person whose genes make them more likely to get it. Female hormones, 70% of people with RA are women. Obesity, and the body's response to stressful events such as a physical or emotional trauma. Research also has indicated that environmental factors may play a role in one's risk for rheumatoid arthritis. Some include exposure to cigarette smoke, air pollution, insecticides, and occupational exposures to mineral oil and silica. Now, it says to learn more about rheumatoid arthritis, they have a couple little links you can click. There's rheumatoid arthritis symptoms, diagnosing rheumatoid arthritis treatment, rheumatoid arthritis self-management, and whatnot. So you can click on those if you want. To check out more, I'm going to go into the symptoms and just read that one. Let's see if it's going to let me. I may have to give this over to Tony, because for some reason in this room, no, not to read it, to get it to load, because in this room it will not.
The bad connection, right.
So can you click on this top one for me, Tony? Rheumatoid arthritis symptoms.
Is rheumatoid arthritis more?
It's the green on the top.
It's like more likely connected with fibro, more than any other kind of arthritis?
I would say that and lupus seem to be very common.
More common, that's
yeah,
what,
the most common things that I hear. There are many other things that I hear. People say that it's connected. Those are 2 very common ones that I hear most often. That's another thing I forgot when I saw my doctor. Every time I go to the doctor, I have this list of things that I want to talk to him about, and he's so wonderful, because they're only supposed to spend so much time with us per, insurance companies or whatnot. And so, usually you give them a couple things and they'll help you with that. But even if that is the case and he can only help me with a couple things, especially when I only had IHP, I now have Aetna, which has helped. he sat down and spent the time and listened to all of the things that I had to say, and because they're important. And some doctors like, I don't have time for that. Let's talk. Tell me the 2 things that I can send you to get a Band-Aid for, and then and send you on your way. Where this doctor, he doesn't do that. He's very
that's a
thorough.
good doctor. 'Cause,
Yeah.
I mean, the fact that you bring up insurance and your time is paid, that's just.
Okay, let's put it this
that's
way.
crazy.
He was letting me know that this is not the best insurance.
Right. But I mean, even the fact that, I mean, people need help, man. Like,
No,
it's-
but that's my point. The fact that he made the point to say,
Yeah.
this isn't the best
He's going
insurance.
above and beyond
but,
based on
but
what
he
they're
still
supposed
did
to.
his job.
Yeah,
And
yeah.
that's the way it should be.
Yeah, exactly.
But it's not.
That's what I know. And that's my problem. Like,
Right.
it sucks that, insurance is, it's like, dude, I need help.
Yep.
How about that? Like,
Yep.
you're a doctor. You know what I
Yep.
need. I get 15 minutes because, like, that's crazy.
Exactly.
But that's
well,
good that he
like
went
10,
above and
like
beyond.
10, 15 minutes tops is like what they're supposed to spend. That's what the insurance companies are giving them. They're allowing them to spend 10,
I
15
didn't know
minutes.
that.
And so basically treating us like a number and saying, okay, number 22, okay, there's 10 minutes. Tell me your 2 symptoms. Okay, I can give you 2 referrals. That's it. That's all you get. He went above and beyond because having one of the worst insurances, because I didn't have any income, and so I basically had Medi-Cal, but it was the IHP. He still treated me like a person, and he still took the time with me, and he still sat down and gave me eye contact and listened to everything I had to say, no matter how long, and I'm sure that I was making him, a little late for next person. But when I go and I'm waiting for a while, I'm totally cool with it, because you know why? Because I know he's spending time with somebody.
Right,
That
exactly,
he's not
doing the
just in
same
there
thing he's
having a
doing-
sandwich.
right.
He's doing the same thing that he
He's
does
doing
for
for
me.
you.
He's doing
That-
it for somebody else. I'm totally good with that. Absolutely.
He's a doctor. He's doing what he
Right.
probably loves doing. Like the
Right.
lady you
Yes.
met today. You know,
Yes.
he probably loves his job. He wants to
So
genuinely help people.
this is how much I loved and respected him, both Bill and I. When we got our Aetna insurance, we requested to have him, and luckily he was within our group, and we got to keep him.
Sweet.
Yeah, so I was super excited. I'm like, I'm keeping this guy. For one, he's an excellent doctor. Number 2, he knows me already. He knows who I am. We've had long conversations. I'm like, nobody wants to start over again. There's nothing worse than having to go to a different doctor, filling out more paperwork, answering the same questions, because you feel like time is being wasted. Because time is of the essence. When we're not feeling well and we want to get things figured out, having to go to a different doctor all the time and more paperwork and more questions, and you just feel like it's such repetition.
Right.
And we don't feel like doing that. We don't barely feel like going to the doctor's office half the time. Sometimes we're dragging our butts out of bed to go to this doctor appointment because we need the medication, we need to be helped. But we really would rather be in bed sleeping or whatever, because we don't feel well, So it's to have a doctor like that makes you want to go and know that they care. It makes a huge difference. All right, so here are the rheumatoid arthritis symptoms. In the early stages, people with RA may not initially see redness or swelling in the joints, but they may experience tenderness and pain. These following joint symptoms are clues to RA: joint pain, tenderness, swelling or stiffness for 6 weeks or longer, morning stiffness for 30 minutes or longer, more than one joint is affected, small joints, wrists, certain joints of the hands and feet are affected. The same joints on both sides of the body are affected. Now that's a big main marker, which is what let me know that I probably had it, because
Same
everything was
joints on
happening,
both sides of
both
the
hips
body,
at the
so
same
elbow,
time, both
elbow,
yes, elbow, both hands, both shoulders, everything was happening in the conjunction together. It was never one-sided, and so that's when I was pretty sure.
That sounds like a big one.
Yeah, it's not fun. Well, then lupus.
Well, I mean, like that would let you know that that's possibly
Yeah.
rheumatoid arthritis.
But then they do the thing, the what is it called? I guess they check your white blood cells. I can't remember the initials, the term, but I'll have to look it up again. I'm sorry, you guys. I'm having a blonde moment. But yeah, there's some tests that you take in order to find out. I guess there's 3 different markers that show that you have it. So along with pain, many people experience fatigue, loss of appetite, and low-grade fever, which I seem to have often. Just I run kind of cool as it is, so if I'm 98, 99, I have a fever, because I'm usually 96 or 97 or something. Like it's 98.7, right? I'm usually 97 something.
Fevers are the
Yeah.
I can't stand fevers.
So the symptoms and effects of RA may come and go. A period of high disease activity, increases in inflammation, and other symptoms is called a flare. A flare can last for days or months. Ongoing high levels of inflammation can cause problems throughout the body. Here are some ways RA can affect organs and body systems. Eyes, dryness, pain, redness, sensitivity to light, and impaired vision. I'm dealing with all of that, unfortunately. Mouth, dryness, and gum irritation or infection. I just have the dryness. My gums actually just went to the dentist today and got good news. I just have one small little cavity that he has to take care of. Lungs, inflammation and scarring that can lead to shortness of breath. Blood vessels, inflammation of blood vessels that can lead to damage in the nerves, skin, and other organs. Blood, anemia, lower than normal number of red blood cells. I have a little bit of that. It's mild so far. And let's see. Then they have side of fibromyalgia. Here we go. Okay, this is the last thing I need to get from you real quick, Tony. This top one where it says read more, RA with a side of fibro. And hopefully that'll come up quick. And so, if you experience that pain, because as you know, fibromyalgia can hit us all over. It's kind of random at times, and sometimes it's an area that aches over and over. But with RA, it's very symmetrical. Like we were saying, both shoulders, both knees.
things, yeah.
So if that's happening, that's a telltale sign that it's very possible. And once again, if you're tested and it's seronegative, doesn't necessarily mean you don't have it. It just means that you're not active. It's not active right now.
What are you saying? Zero negative? Or
Sero. S-E-R-O.
It's like zero in Spanish.
Yes.
What does zero negative mean?
It just means that it's not showing that you have it
So
yet.
it's zero negative?
Yeah, basically.
What? It's zero in Spanish and it means zero.
No, I didn't think about that. That's funny. So here's the next one. RA with the side. That's funny. I didn't even think about that.
Right. When you first said it, I didn't want to interrupt you.
Right.
So
No, it's all good. RA with a side of fibromyalgia. For years, fibromyalgia was a mystery illness. No one knew what caused it, how to diagnose it, or how to beat or treat it. Some people, including doctors, even questioned its existence. In the last few years, however, researchers have cleared up some of the mystery, although much about fibromyalgia still isn't understood completely. Two things are clear. It's very real, and it affects a disproportionate number of people with rheumatoid arthritis. What is fibromyalgia? Fibromyalgia is a syndrome marked by widespread pain, fatigue, poor sleep, and memory problems. It's often associated with other symptoms too, including headache, irritable bowel syndrome, increased sensitivity to temperature changes, light and sound. In some respects, it can resemble RA, which is why patients with both RA and fibromyalgia sometimes go years without the fibromyalgia being diagnosed. Unlike arthritis, however, fibromyalgia doesn't affect or damage joints or other tissues. Fibromyalgia pain tends to occur where arthritis pain doesn't, such as the trunk, back, and muscles, in the thighs and arms. Explains Daniel Claw, MD, if I'm saying that right.
The trunk?
The trunk, yeah. Your center, stomach, sides, back, the center area.
That's referred to as a trunk? Mm-hmm. The trunk area? Mm-hmm. I've never heard that before.
Between your waist and your chest.
Oh.
So, Professor Daniel Claw, MD, a professor at the University of Michigan and noted fibromyalgia researcher, qualitatively is a different kind of pain, too, more diffuse and migratory, not as constant from day to day as, say, rheumatoid arthritis in a finger joint. The cause of fibromyalgia pain is also different. Instead of resulting from inflammation, it's thought to result from changes in the way the brain and spinal cord process and transmit pain signals. Robert Bennett, MD, professor emeritus at Oregon Health and Science University in Portland, Oregon, and this is not important, I shouldn't even read this. Fibromyalgia pain impulses are intensified, as if the volume on a ratio has been turned up to full blast. Dr. Claw and colleagues first demonstrated an association between fibromyalgia and heightened pain response in 2002. In their study, people with fibromyalgia had measurable responses to gentle finger pressure in pain processing areas of the brain. It took twice as much pressure to create similar responses and controls. These findings have since been corroborated by other research, including a 2013 Harvard study published in Arthritis and Rheumatoidism, suggesting that the brain of people with fibromyalgia are less able to guard against pain signals. This hypersensitivity to pain is known as central sensitization. Double trouble, having inflammatory forms of arthritis, increases the risk of fibromyalgia. This may be due, at least in part, to chronic pain itself, which causes the brain to become highly sensitized, not only to things that hurt, but also things that aren't normally painful. The hypersensitivity makes arthritis pain worse and can create widespread pain and other symptoms such as fatigue, even when arthritis is well controlled. Another physician at the Mayo Clinic, people with fibromyalgia have pain receptors firing all the time. And in fighting that pain, people become fatigued, have unrefreshed sleep and cognitive problems. And it's important to recognize that chronic pain kicks the symptoms burden much higher. If it's not clear how many people with RA have fibromyalgia, researchers used to think it was around 20-30%, but that number may now be too low. The current thinking based on 2013 study in the Arthritis Care and Research is that fibromyalgia is a spectrum disorder, with symptoms ranging from mild to severe. That means more people are likely to fall under the fibromyalgia umbrella. Once patients are diagnosed with RA or lupus, rheumatologists tend to attribute all pain and fatigue to the autoimmune disease. What can end up happening is that RA is overtreated with disease-modifying drugs or biologics because symptoms such as fatigue and memory problems persist even after joint swelling and inflammation are reduced. Persistence of symptoms should be a blinking neon light to look for central sensitization, Dr. Claus says. How is fibromyalgia treated? Dr. Claus says one of the most common misconceptions is that there are no effective therapies for fibromyalgia. Fibromyalgia requires both pharmacological and non-pharmacological therapies. He explains pharmacological therapies address pain processing, and non-pharmacological therapies, that's a mouthful, address the functional consequences of pain. So for instance, we know physical activity is extremely important. Research has repeatedly shown that regular activity is one of the most effective treatments for pain symptoms. Okay, I have to stop there. And I'm not going to read much more. I'll let you guys check out the rest because I'm running out of time. Oh, well, there's a little bit left. I can finish. So not everybody can exercise. I know they say exercise, not all of us can. Some of us are so debilitated that we can maybe go for a walk, but that's about as far as exercise goes. They're saying that, keep exercising, everything's fine. When I try to exercise, my pain goes through the roof. So walking is about all I can do. I do some light stretching, maybe do some squats or lunges or something once in a while just to keep my muscles engaged. But actual exercise, I'm a wreck. I'm a hot mess. So any kind of exercise that's pumps up my heart so much that I'm sweating and I'm red and I'm hot, and it's inevitable that the very next day I'm going to be down for the count. So in my experience and many people that I've talked to, regular activity can just be something simple like walking if you can manage that. But even that's tough for some people. But actual exercise, I'm sorry, not all of us can do the actual exercise. And the fact that they say that is incorrect. And so I have to disagree with this part of the article because from my experience and other people I've talked to, that it doesn't work for everybody. So it continues on. Just as it is one of the most effective treatments for arthritis, the active. Now, for arthritis, yes, definitely you want to be mobile. If you have arthritis, you want to be as mobile as possible. Once again, walking is it's not too hard on your joints. You're not running. You're not impacting your joints by running or jogging. Walking is very simple. It's very easy. You don't have to breathe too hard. It's actually the safest and best way. I tell people to take it slowly because if they do try to do too much at first, they get frustrated. That's with anything. Deep restorative sleep is also essential for reducing chronic pain. Deep restorative sleep. Ha! That's hilarious. But for many people with fibromyalgia, that's easier said than done. Pain interferes with normal sleep, and lack of sleep makes pain worse. Conversely, a good night's rest can significantly improve fibromyalgia symptoms. The rarity of that is few and far between. Relaxation techniques, meditation, massage, deep breathing, and cognitive behavioral therapy, a type of therapy that can help change certain thought and behavior patterns, are also helpful in relieving pain and fatigue. Non-pharmacologic approaches are particularly important because the 3 drugs approved treat fibromyalgia. Lyrica, Cymbalta, Savella, and then their counterparts are only moderately effective. Dr. Claw emphasizes that most patients find relief with a combination of treatments. Savella is what I use. I've tried everything else. It works pretty well for me. I'm very adamant about how much I take once again, so when I get to 100 milligrams and it starts not to work, I wean myself off and start over again. That way I don't have to use more. And finally, he also recommends that people with RA have ongoing pain and other symptoms ask their doctor about fibromyalgia. So if you are one of the people that have rheumatoid arthritis but haven't been diagnosed with fibromyalgia, definitely bring it up because that could be some of your extra pain. And vice versa, you have fibromyalgia, but you have this uniform pain going on, and fibro meds probably aren't helping with that. It's very likely that you have RA or lupus, or, you know, there's so many other things it could be. It's unfortunate, but fibro is tied to many, many things. So always check it out. It could be more than one thing. It's not necessarily just fibromyalgia. So thank you guys, as always. I'm dry and hot. Ran a little long. I wanted to get that other part of the article out. Thankfully, I could squeeze in there real quick. Go get yourself checked. Tell your doctors how you're feeling. Make them listen to you, because even if you're the 10-minute doctor, you know, oh, I have to get you now. Tell them as much as the most important things. Make a list. Making notes is most important, so that way you remember, because my memory sucks. I have to make notes. So that way when I get in, I can say, here's my notes. This is what I want to talk about. So much easier. Takes some stress off of you. You won't forget, and that's really helpful. So just keep that in mind, okay? All right. As y'all know, you're not alone. I love you. 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 I used to make a joke. Come to Fantasy Island where nothing is free and the seats are full of pee. Seriously, all the seats at the table, this little old lady, she was so sweet, but she would pee in all of the chairs. And it was so bad.
She played a lot, and
she
would
played
just
a lot.
have accidents in the chairs.
She had accidents. She was quite old, but she loved playing. And instead of, I guess she didn't wear Depends, or if she did, she peed a lot. I don't know, but every time she got up to leave, you'd see that she had peed. And it's not something you want to say.